everyone, my name is Patricia Bella, and I will be presenting integrative nutrition therapy for hormone imbalances, focusing on DHEA, or better known as dihydropanetestosterone. In women, I will be going over the historical origins, principles and mechanisms, safety protocols, side effects, evidence-based efficiency, education and training, real-life experiences, as well as cultural significance and societal implications. So the historical origin of DHEA, DHEA was founded and identified in the 1930s. By the 1970s, it was known to be the so-called youth hormone, as it was shown to help and improve individuals' energy as well as vitality. It started out as a youth hormone and it has now shifted to the present day to help and support the adrenal hormone production in women. Principles and mechanisms. DHEA primary source comes from the adrenal gland that results in producing estrogen. It is a precursor to estrogen, as well as the production peaks in an individual of women in their early 20s, and they will start to steadily decrease as the woman's age. Once a woman hits the age of 30, their DHEA levels will start to decrease significantly. Women will start to take supplements when they are premenopausal, menopausal, and postmenopausal stages in their life as well. Safety protocols. DHEA is a hormone supplement. Professional guidance is highly recommended, but not necessary. Proper nutrition is a much safer approach than taking these supplemental hormones. Do not use if you're pregnant and or breastfeeding. As well, they do not advise to be taking DHEA hormone supplements with estrogen, as they may result in excessive amounts of estrogen that can potentially cause symptoms such as headaches, insomnia, and nausea. Side effects. Some side effects of DHEA supplemental hormone may increase the hormones to be sensitive to cancers, for example, breast and ovarian in women. DHEA may result in reducing good cholesterol levels as well if you already have a pre-existing condition, as well as common side effects as oily skin, acne, and unwanted hair growth known as hirsutism, which is excessive hair growth in the facial areas. Evidence-based efficiency. DHEA has shown to improve as well bone density in postmenopausal women. As women progressively age, their bone density starts to decline. That can potentially become and result in osteoporosis. DHEA can help a lot with regulating a woman's hormones, but evidence shows that DHEA, along with proper diet, can always help with the natural production itself. So for the education and training, education is highly required in endocrinology as well as nutrition. Most of the people that focus on helping with supplemental health, it is the registered dietitian nutritionist, or known as RDNs. RDNs typically will pursue and specialize in nutrition and endocrinology in order to better help and safely teach and inform individuals of hormone supplements. So, some of the real life experiences women have reported to have more energy, better mood during and after menopause when consuming DHEA supplements. They as well will increase their libido, improving joint pain as well as improving their skin appearance, which reverts back to the bone density as well as the aging process. Women have also reported that they quote unquote start to feel like themselves again. Insurance coverage. Some DHEA medications are covered by insurance, while most of the medications are out of pocket as they are considered over the counter. And over the counter supplements are not typically covered by insurance. But one recommendation that they do say is to call your insurance to be sure of what kind of coverage you may have with certain supplements, if they are over the counter or if they are prescribed. As well, when speaking to a nutritionist or an RDN, nutrition coverage is very limited to receive the proper help in your supplementals, but you can as well you can always contact the insurance to see how much of that they will cover instead of you paying out of pocket. The practice requirements within the United States. They vary throughout the United States, as well as prescribed dietary supplements must be done through a licensed healthcare provider. DHEA is sold legally as a dietary supplement here in the United States, but in other countries it is considered a controlled substance. As well as the FDA does not regulate any of the DHEA supplements. The cultural significance, as you can see on the picture to the left, it is a woman that is starting to show signs of aging. And one of the main cultural significance that I have found is that they view the DHEA, like previous stated in women, as a fountain of youth or the youth hormone. Its main significance would be for anti-aging, as women do not have the youth, quote unquote, or no longer desirable. Therefore, this supplement is very important to the women in the Western culture society. Societal implications. Nutrition is more beneficial than supplementation. The most important thing in the society for women as well as men is their physical appearance, as well as when taking DHEA supplements is to the improvement of quality of life and the well-being of an individual. DHEA supplements are marketed more to women and as well as men to maintain youthful appearances, energy, and high mood as well. Thank you for listening to my presentation. And here is my reference page. For the hormone therapy in men,